This medication contains two hormones, a progestin and an estrogen, and is used to prevent pregnancy. In addition to preventing pregnancy, it can also help make periods more regular, reduce blood loss and painful periods, decrease the risk of ovarian cysts, and treat acne. It's important to note that this medication does not protect against sexually transmitted diseases. The daily dosage and optimal timing for taking this medication should be discussed with your healthcare provider. Before starting to take this medication, make sure to read the instructions provided by your pharmacist. This will give you important information on when to take your pills and what to do if you miss a dose. It's important to take this medication by mouth as directed by your doctor, usually once daily at the same time each day. If you are taking the chewable tablet, be sure to follow the manufacturer's directions for your specific brand. It's crucial to take this medication exactly as prescribed by your doctor. Different brands of birth control pills may vary in the amount of estrogen and progestin at different times in the cycle, so it's important to follow the package instructions carefully. Missing pills or starting a new pack late can increase the risk of pregnancy. If you experience vomiting or diarrhea, it can affect the effectiveness of the birth control pills. In this case, you may need to use a backup method of birth control, such as condoms or spermicide. Taking this medication after your evening meal or at bedtime may help if you experience stomach upset or nausea. Your pill pack contains 21 pills with active medication and may also contain 7 reminder pills with no medication. You should take one active pill once daily for 21 days in a row, followed by 7 days without taking any tablets, during which time you should have your period. After the 7 days, start a new pack the next day, regardless of whether or not you have your period. If this is your first time using this medication and you are not switching from another form of hormonal birth control, you should take the first tablet in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. For the first cycle of use only, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy. Always consult your doctor or pharmacist if you have any questions or if any information is unclear. Some common side effects of Ethynodiol-Ethinyl Estradiol include nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, and weight change. You may also experience vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If any of these effects persist or worsen, it's important to contact your doctor. Keep in mind that your doctor has prescribed this medication because they believe the benefits outweigh the risks of potential side effects. However, it's essential to monitor your blood pressure regularly and inform your doctor if it becomes elevated. Additionally, be sure to seek medical attention if you experience any serious side effects, such as lumps in the breast, mood changes, severe abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing of the eyes/skin. This medication may also rarely lead to serious problems from blood clots, so it's crucial to seek immediate medical help if you experience symptoms such as chest pain, confusion, sudden dizziness, trouble speaking, or vision changes. While rare, a serious allergic reaction to this medication may occur. If you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing, seek medical help right away. It's important to note that this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you experience any other effects. And remember, contact your doctor for medical advice about side effects, and report any side effects to the appropriate regulatory agency in your country. If you are over 35 years old and smoke cigarettes or use tobacco, it's important to avoid using Ethynodiol-Ethinyl Estradiol. This is because smoking can increase your risk of experiencing serious side effects such as stroke, heart attack, blood clots, and high blood pressure when using hormonal birth control like the pill, patch, or ring. The risk of these issues becomes higher as you get older and smoke more cigarettes. It's best to refrain from smoking or using tobacco while taking this medication. Before taking this medication, it's important to inform your doctor or pharmacist if you are allergic to any estrogens or progestins, as this product may contain inactive ingredients that can cause allergic reactions. It's also important to disclose your medical history, especially if you have a history of certain health conditions such as blood clots, high blood pressure, cancer, high cholesterol, depression, diabetes, heart problems, kidney or liver disease, obesity, stroke, thyroid problems, or unexplained vaginal bleeding. If you have diabetes, this medication may affect your blood sugar levels, so it's important to monitor your blood sugar regularly and share the results with your doctor. It's also important to let your doctor know if you have had or will be having surgery, as well as if you will be confined to a bed or chair for a long time, as these conditions can increase your risk of getting blood clots. It's important to be cautious if you have diabetes, phenylketonuria, PKU, or any other condition that requires you to limit or avoid sugar and/or aspartame, as chewable tablets may contain these substances. Additionally, it's important to inform your doctor about all the products you use before having surgery, including prescription drugs, non-prescription drugs, and herbal products. This medication may cause blotchy, dark areas on your face and skin, so it's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and wear protective clothing when outdoors. If you are nearsighted or wear contact lenses, you may develop vision problems or have trouble wearing your contact lenses, so it's important to contact your eye doctor if these problems occur. It's important to note that it may take longer to become pregnant after stopping this medication, and it should not be used during pregnancy. If you become pregnant or think you may be pregnant, it's important to inform your doctor right away. Additionally, this medication may decrease breast milk production and may have undesirable effects on a nursing infant, so it's important to consult your doctor before breastfeeding. When taking Ethynodiol-Ethinyl Estradiol, it's important to be aware of potential drug interactions. Some medications may change how Ethynodiol-Ethinyl Estradiol works, or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Additionally, some drugs may cause hormonal birth control to work less effectively, increasing the risk of pregnancy. If you start any new drug, it's important to inform your doctor and discuss if you should use additional reliable birth control. It's also important to notify your doctor if you experience any new spotting or breakthrough bleeding, as these may be signs that your birth control is not working well. Additionally, this medication may interfere with certain lab tests, so it's important to inform lab personnel and all your doctors that you use this drug. If you or someone else has accidentally taken too much Ethynodiol-Ethinyl Estradiol and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222, while in Canada, call a provincial poison control center. Symptoms of an overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It's important not to share this medication with anyone else. It's also important to have regular physical exams and medical tests while taking this medication, including blood pressure checks, breast exams, pelvic exams, and pap smears. Make sure to follow your doctor's instructions for examining your breasts, and report any lumps right away. Don't miss any medical or lab appointments, and consult your doctor for more details. If you miss a dose, refer to the product package for instructions. You may need to use additional birth control methods to prevent pregnancy. If you have trouble remembering to take your pills, talk to your doctor about other birth control options. When storing Ethynodiol-Ethinyl Estradiol, it's important to keep it at room temperature and away from light and moisture. Make sure to store it in a place that's not the bathroom, and always keep it out of reach of children and pets. If you no longer need the medication or it's expired, be sure to dispose of it properly. You can ask your pharmacist or local waste disposal company for guidance on the correct way to do this. Remember not to flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.